The country has recorded a little over 8,500 new COVID-19 cases, all in the past 24 hours. The Omicron variant has now overtaken its predecessor, the Delta variant, to become the most common form of the COVID-19 virus circulating in South Africa. Let's get an idea now about what the data tells us about this latest variant. Joining me from the Bhekisisa Centre for Health Journalism is Aisha Abdool Karim. Aisha, very good morning to you. Thank you so much for joining us. With the Omicron variant overtaking its predecessor, of course, we're seeing the result on the ground with the numbers going up every single day. What do we know about the pace and how quickly this virus is spreading?
Okay, so good morning and thanks for having me on the show. I think that what's important to note about the Omicron variant is that it's still in its very early stages of discovery. So what that means is that scientists are working as fast as they can, but there is still a lot to learn about it. So one of the reasons why it became, a concerning form of the virus that was identified was simply because it had such a large number of changes to its structure. It is one of the most mutated forms of the virus that has been discovered, to date, with over 50 changes to its structure. And something that became apparent very quickly was that, one of the benefits of these changes to the virus is that it was able to spread extremely quickly and efficiently from person to person. And so what we saw in South Africa was a very sharp increase in infections, particularly in Gauteng, because that was where the Omicron variant was first identified. And as you mentioned, the peak of infections very quickly overtook the peak from the previous wave, which was caused by the Delta variant. And so while we don't have exact numbers yet, it is clear that this is a variant that's able to spread more quickly than previous variants. And I think also what's important to note is just that the situation in South Africa was that we were in between waves, which meant that we had a low level of infection already. So it allowed the Omicron variant to come in and very quickly drive a new wave. Because there wasn't much competition with another variant or another version of the virus. That's why we saw Omicron become not only the dominant form of the virus that was, driving this wave, but also very rapidly cause, that spike that we saw in the number of new cases that was happening.
As you speak to some of the questions that are being asked about this variant, you say that, of course, there's still a lot to learn about it. We know that some of the top COVID-19 scientists have now been on the receiving end of vicious backlash, a lot of intimidation, abuse, and even death threats. What is it that is ruffling these feathers and making some corners so uncomfortable that they have to resort to such measures on the scientists who are doing the research when it comes to trying to find some answers?
Yeah, so I think that, we need to recognize that South Africa was one of the first countries to identify this variant along with Botswana, and that was because of the strength of our genomic surveillance team. And so that is a group of labs and scientists across the country whose job it is to continuously monitor and track how our epidemic is evolving. And so part of that involves them keeping an eye out for new variants. And because they were sort of primed to see a new variant, and because they continuously keep an eye out, it's why they were able to, detect Omicron so quickly. And I think that there's, a few issues. The first one is that there is an incredible amount of pressure placed on scientists to answer questions as quickly as possible, particularly when it comes to something, like a new variant, which is concerning, because people want to, know key facts about it, such as what does it mean for vaccines? What does it mean for, how serious the disease is that's caused by this variant, and, primarily how quickly is it spreading as well. And, the thing is that science can only move so quickly, and so a lot of these questions, particularly around the vaccine efficacy and how severe the disease, it's stuff that needs a lot of data, and not just information from South Africa, but from other countries as well, so that we can understand how the variant is playing out in different contexts. And I think that it's a combination of that need for definitive answers in a time where scientists can't really, give you a conclusive statement yet because they're still trying to do the work. And I think another component to the backlash that scientists are facing is the reaction that the rest of the world had to the announcement of Omicron, with the response of travel bans and imposing restrictions on South Africa and other Southern African countries, which, the science doesn't support those kinds of moves. There's no evidence that shows that restricting travel from countries will stop the spread of a variant. And, at this point, the variant has already been detected in over 50 other countries. So I think that scientists were facing a lot of pressure to provide answers, but also that was against the backdrop of the repercussions that the country and South Africa's economy was also facing in light of the restrictions that was being imposed upon us.
Absolutely. We're going to have to leave it there for now. Thank you so much for weighing in on that discussion. That was Aisha Abdool Karim, a health reporter from the Bhekisisa Centre for Health Journalism, just bringing us up to speed with some of the reasons behind some of the pressures that we're hearing of when it comes to the top COVID-19 scientists working to establish the facts on the Omicron variant.